I'm Dr. Logan Dellinger. I'm an emergency room physician here at Jasper Memorial Hospital.
Hi, I'm Dr. Tretter. I'm the Chief Medical Officer at Memorial Hospital.
The hospital is always a safe place to receive care if you need it, and we've taken numerous precautions to maintain safety of our patients and keep our patients that we are concerned for coronavirus away from patients that are less likely to have coronavirus.
We have certainly put in a lot of changes over the last month as this pandemic has evolved. We limit visitors. We have not only visitor restrictions, but those who do come into the hospital are appropriately screened to make sure they can come in. Our staff are screened. We wear all the appropriate masks and other equipment that we need to keep ourselves as well as our patients safe. And as Dr. Dellinger said, we certainly separate the patients so that patients who are there receiving other types of care are not exposed to patients who may be potentially infectious.
Overall, our volumes are down in the emergency department, but our acuity is way up. And what that means to me, especially because the people that come in are sicker, they seem to be later in their disease course. So I think people are staying at home and trying to avoid the hospital, kind of, crossing their fingers, hoping they get better. But what happens is they end up coming in much worse because they want to try to avoid the hospital. I also see a lot of people that don't know that the hospital's open. They call and ask if the emergency department is still seeing patients, and we are. We're open. We treat everything we treated before the coronavirus, and if you need us, we're here.
Classic symptoms of COVID-19 have always been fever, cough, shortness of breath. But as we've gotten more experience with this illness, we've also seen that there's other secondary symptoms that some people have, such as diarrhea or stomach pain, also fatigue, muscle aches, lack of energy, headaches, loss of smell or taste. All of those can be symptoms related to COVID-19 as well. So really there's a multitude of symptoms, but primarily it's still the cough, fever, and shortness of breath that most individuals have. We have several options for patients. Certainly they can call our triage number if they just have questions about their symptoms. That number is 812-996-6330. Or we have an alternate screening site located on West 2nd Street here in Jasper, across from the IGA grocery store. That location is open every day from 9 a.m. to 5 p.m. And that's 7 days a week that it's open. And patients can walk into that clinic to be screened for their respiratory symptoms. So again, patients with those fever, cough, shortness of breath. There they'll be treated by a nurse practitioner or physician and evaluated for any type of illness, including flu, strep, pneumonia, but also those who require further evaluation and meet the qualifications for COVID-19 testing might also receive that type of testing. Certainly if a patient is so sick that they require a higher level of care, then we recommend they go straight to the emergency department as they always would have done so. So as you're probably aware, Governor Holcomb recently announced that hospitals and healthcare organizations can start to resume some of the previous services that were put on hold because of the pandemic. So here at Memorial Hospital and Healthcare Center, we've been actively working to start to increase our ability to provide those services. So that includes things like elective surgeries, colonoscopies or other endoscopy procedures, radiology procedures, mammograms, and really all the services that we've offered before. Now, in order to do this, we're going to do them in a phased approach, which means we're going to start slowly and beginning to offer these over the course of the next few weeks as we've had to take some changes in our procedures to make sure that we keep areas clean, we keep waiting rooms with a few people present, and really to continue to keep our patients safe and our staff safe as we do so.
The community's been doing a great job of following the state guidelines and the CDC guidelines as far as social distancing and wearing your masks in public and that kind of thing. And I think we need to continue to use common sense. And if you feel sick, stay away from other people. I know that we are open, and if you need medical attention, or if you think you need medical attention, then you should get that medical attention, whether that's our alternative screening site or the emergency department or your family doctor. But know that if you feel like you need to see a doctor, you can, and we are open, and we're still treating everything we treated before, and in a safe way.
I want to thank our community for all the support that you have shown to us, everything from prayers and gifts and treats and meals and supplies and masks and all the great things that have been donated and provided to us. We appreciate the support of the community, and a special thank you to all the employees of Memorial Hospital and Healthcare Center for all the great work that you do. We appreciate your dedication during these difficult times, and certainly you're heroes to us. Thank you.
A big thank you to the emergency department and all the staff that works within the emergency department. You guys are doing a great job. You're providing excellent care to patients, and you guys should all be commended for that. I'd like to thank the whole community, the whole hospital system, everybody for doing such a great job and helping to keep everybody safe during the pandemic.